What if you could spot a warning sign of heart disease just by looking at someone's face, their hands, or even their ears? It sounds strange, but it is real. The body often leaves clues on the outside long before a person feels anything is wrong on the inside. In this video, you are going to learn 7 visible signs that may point to a problem with the heart or the circulation. They show up on the face, in the eyes, on the skin, on the ears, and even on the nails. Some of them are surprisingly easy to spot once you know what to look for. And one of them, the last one, can be a clue to an infection that is genuinely life-threatening. But before we start, one honest and important promise. These signs are clues, not diagnoses. Seeing one of them does not mean a person has heart disease, and not having them does not mean someone is safe. They are simply reasons to pay attention and, when needed, to get checked by a doctor. Keep that in mind for every single one of these because no one should diagnose themselves from a video. With that said, let's look. First, let's understand why this is even possible. Heart and blood vessel disease is the leading cause of death in many countries, including Brazil. And much of it builds quietly over years through a process called atherosclerosis. Picture the inside of your arteries like the pipes under your sink. Over time, with high cholesterol, high blood pressure, smoking, diabetes, or just genetics, a sticky buildup can collect on the walls and narrow the flow. The remarkable thing is that the same process that clogs the arteries to your heart can leave small, visible footprints elsewhere on the body. Those footprints are what we are about to read. Sign number 1. The diagonal earlobe crease, also known as Frank's sign. This one is easy to miss until someone points it out. It is a diagonal line that cuts across the earlobe, running from the ear canal down toward the outer edge, almost as if the lobe had been lightly creased. Here is why it matters. Research has linked this crease to a higher risk of atherosclerosis and coronary artery disease. One large study of over 1,000 adults found that the crease was independently associated with higher cardiovascular risk scores, especially when it was deep on both ears and complete. Now, on its own, it is not a diagnosis, and the accuracy is modest, but it is a genuine reason to check the rest of the picture. So if you notice a deep diagonal crease on both earlobes, especially alongside other risk factors, it is worth mentioning to a doctor. Had you ever heard of this one? Because the next sign hides on the fingertips. Sign number 2, clubbing of the fingers. Doctors call this digital clubbing, and once you have seen it, you never forget it. The fingertips become wider and rounder, and the nails curve over the top, taking on a shape a bit like the back of a spoon or the glass of an old pocket watch. Why does this happen? It is usually the body's response to long-term low oxygen in the blood. When tissues are starved of oxygen over time, the body reacts, and one of the changes is abnormal growth of tiny blood vessels in the fingertips, which thickens and rounds them. Clubbing is most often connected to chronic lung conditions, but it can also appear with certain heart conditions present from birth, the kind that mix oxygen-poor and oxygen-rich blood. The takeaway is simple. Clubbing is a sign that something has been limiting oxygen for a while, and it deserves a proper medical evaluation. Now let's move from the hands to the eyes. Sign number 3. Yellow cholesterol deposits around the eyes and skin. You may have seen these without knowing their name. Soft, yellowish patches that appear on the eyelids, most often near the inner corner of the eye, are called xanthelasma. Similar yellow or orange bumps that show up over the joints, like the elbows, knees, or hands, are called xanthomas. Both are small deposits of cholesterol settling into the skin. They are more common after the age of 40 and often, though not always, go along with high cholesterol in the blood. And here's the part that surprises people. A large long-term study following nearly 13,000 people found that those with xanthelasma had a higher risk of heart attack and heart disease, and that this held true even independent of their cholesterol levels. The evidence is mostly supportive, though not every study agrees, so think of these yellow patches as a flag worth investigating, not a verdict. In the same family, 2 related signs are worth knowing: a grayish or whitish ring around the colored part of the eye, called arcus corneae, which is more common after 50, and soft fatty lumps under the skin. Now the next sign is less about buildup and more about the body's blueprint. Sign number 4. unusually long limbs, and long, thin fingers. Some people are naturally tall and slender, and that is perfectly normal. But there is a specific pattern that doctors watch for. People with a genetic condition called Marfan syndrome tend to be taller than average, with an arm span that exceeds their height, and with strikingly long, thin fingers that look almost disproportionate. They are often very flexible, with loose, hypermobile joints. Why does a cardiologist care about body shape? Because Marfan syndrome affects the connective tissue that holds the body together, including the wall of the aorta, the main artery leaving the heart. This raises the risk of the aorta widening, forming an aneurysm, and in serious cases, tearing, which is a true emergency. The important and reassuring part is that not everyone with these features has Marfan, and not everyone with Marfan will develop aortic problems. But it is exactly why these individuals should have their heart and aorta monitored regularly. Recognizing the pattern can be life-saving. Speaking of the alarm bells, the next sign is one you should never ignore. Sign number 5, a bluish color of the lips, skin, or mucous membranes, called cyanosis. This one is a louder alarm. Cyanosis is a blue or purplish tint that appears on the lips, the skin, or the inside of the mouth, and it happens when there is not enough oxygen in the blood. It is a direct sign that something is interfering with how oxygen is moving through the body, and it can point to serious problems in either the heart or the lungs. In heart failure, for example, the heart cannot pump blood efficiently, and circulation to the edges of the body slows down. In newborns, certain severe heart conditions present from birth can cause a baby to turn blue very early, sometimes needing surgery within the first weeks of life. Here is your safety rule for this one. If you ever see cyanosis appear suddenly, especially with shortness of breath, chest pain, or dizziness, that is an emergency, and you should seek medical help immediately. Now let's come back down to the legs. Sign number 6, swelling of the lower legs and feet, called edema. This is probably the most familiar sign on the list. You have likely seen feet, ankles, or legs that look puffy and swollen, sometimes so much that a sock leaves a deep mark. Swelling like this can be a sign of heart failure, particularly when it comes together with shortness of breath and fatigue. When the heart cannot pump blood forward effectively, fluid tends to back up and pool in the lowest parts of the body, which are the legs and feet. Now, to be fair, swollen legs have many possible causes. They can also come from kidney problems, liver problems, or trouble with the veins in the legs. That is exactly why a proper exam matters, because the pattern and the accompanying symptoms point toward the real cause. The single most important thing to remember is this: consistently swollen feet or legs are not normal, and they deserve to be checked rather than ignored. And now we arrive at the last sign, the most serious one. Sign number 7, small, painful red nodules on the fingers and toes, called Osler's nodes. These are easy to overlook because they are small, but they carry a heavy meaning. Osler's nodes are little reddish bumps that appear on the tips of the fingers and toes, and the key detail is that they are painful to the touch. They are associated with infective endocarditis, a severe infection of the heart valves. This infection happens when bacteria or fungi get into the bloodstream and settle on a valve. Something as ordinary as an untreated dental or skin infection can, in some cases, lead there. The nodes themselves form when tiny clusters from the infection travel out and lodge in the small vessels of the fingers and toes, triggering a painful inflammatory reaction. Endocarditis usually comes with fever and chills, and it is a genuine medical emergency that often requires hospitalization and powerful intravenous antibiotics. So a painful red bump on a fingertip paired with fever is not something to wait on. It is a reason to seek care quickly, and that is the most important lesson of all 7 of these signs. Your body is constantly communicating. None of these marks is a diagnosis on its own, but each one is the body's way of asking you to pay closer attention. So if you ever notice one of them in yourself or in someone you love, do not panic, and do not ignore it either. Take it as a simple invitation to get checked, because catching something early is always easier than treating it late. Pay attention. That is the whole message. The people who learn to read these signs are the ones who get answers sooner. If this helped you see your body a little differently, subscribe for more clear, science-based health content.